Good day, students. In this chart, we shall be dealing with a very important topic of leprosy, which can be a question in any form, either in microbiology or pathology. And in the chart, we shall be having the spectrum of changes seen in the disease, the clinical manifestations, and the classification. First, let us go to the classification. Classification is an aid to orderly thinking. That's what my dermatology professor has taught me. There is an infection with Mycobacterium leprae. Most of us would have got exposed to it, but then the majority do not have a disease or any manifestation whatsoever. In some people, however, there is a non-specific inflammation. Even when the slide comes to us, we are not able to make a specific diagnosis, and it is a case of indeterminate answers. Based on the exposure and the immune status of the host, you find that there is a spectrum of manifestation, starting from one pole called the tuberculoid and the other pole called lepromatous. These are the polar forms of leprosy. In the middle, you have got what is called as borderline. Coming back to the classification proper, it can be tuberculoid, borderline, or lepromatous. In between these two, I have got a borderline tuberculoid, and between borderline and lepromatous, I have got a borderline lepromatous. There are two reactions which are very common. One is called erythema nodosum leprosum, which we use for what we call as downgrading or upgrading. The patient is either improving or deteriorating. There is also something called the reversal reaction. What we are seeing in this case is a paucibacillary form in tuberculoid Hansen's and a multibacillary in the case of lepromatous leprosy. And these are pictures given in your opins also, which you people can make use of. First, let us see the histology of lepromatous leprosy. In this one, I find that there is a thinning of the epidermis. There are no elongations in the form of rete ridges. So this is actually the inflammatory lesion. But in between, I am finding an unaffected or rather relatively clear zone, which is called the unknown band of Anna, UNNA. He is supposed to be a dermatologist. Or the Gren zone. These are two people who have contributed, and it is called either the unknown band of Anna or the Gren zone. Below that, there are sheets of large cells, foamy macrophages. They are continuing over here also. This insert I have given just to show how much of bacterial load they have got. All these red lines are the bacteria. They are multibacillary. When I go to a slightly higher magnification of the same, I find that these are the cells. The cells are large. They have got the vacuolated cytoplasm. They are called what is called as the Furcose cells. And the bacilli are present in the form of cigar bundle or a fish in a stream appearance. And these are called the globi. This is the classical feature of lepromatous leprosy. And what about the clinical manifestations? This is exactly what we see. A very coarse feature. There is a thickening of the skin, wrinkling of the skin, absence of the lateral half of the eyebrows. Sometimes even the eyelashes are lost, so that the patient goes in for an exposure keratitis. The bacilli gets located in the cooler parts of the body, and one area is the nares, the nasal septum. So in this case, there is a collapse of the bridge of the nose, leading to what is called a saddle nose deformity. There is also a thickening of the tragus and the ear lobule. These are the features and they resemble a lion, hence it is called as leonine faces. Once again, it is depicted in this picture. Loss of the eyebrows, the eyelashes, exposure keratitis, thickening and coarse faces, collapse of the bridge of the nose, thickening of the earlobe and the tragus. This is incidentally a creature called the armadillo, 9-banded armadillo. It has got 9 bands, hence the name 9-banded armadillo, which is an anteater. This has been used for study purposes because the manifestations in this is exactly the same as the human being. However, with leprobacillus, no culture is possible. That is how we have got a difficulty in approaching a complete diagnosis and cure. That being said about lepromatous leprosy, the next one will be tuberculoid leprosy. So look at the skin over here. This is again the epidermis. There are downward elongations called the rete ridges. There is no flattening. And tuberculoid means OID is a suffix which means similar to. So what do you see in tuberculosis? You see granulomata. Similarly, here also there is a granuloma. Another granuloma is over here. So these are the epithelioid cells, large pale cells with vesicular nucleus. And you can get Langerhans type of giant cells also. And the dark dots are the lymphocytes. So you find the lymphocytes over here. These components, the epithelioid cells, the giant cells, and the lymphocytes are rimmed off by means of a network of fibroblasts. The intervening dermis is unaffected. Mostly these granulomata are periappendageal around the sweat glands or the hair follicles. That is why you have absence of sweating or loss of the hair follicles. Clinically, the patient can be presenting with hypopigmented patches. So look at this one, hypopigmented and anesthetic patches. Even when there is a pinprick, he will not be able to realize. There is a thickening of the posterior auricular nerve or the ulnar nerve that can be made out. Due to lack of sensation, there can be auto-amputation and trauma to the digits. This is a classical diagram which you people can draw for any granulomatous disease, including leprosy and tuberculosis. In the center, I am finding large pale cells with vesicular nuclei. These are the epithelioid cells. They are nothing but modified macrophages. They get modified, become epithelioid cells. They can join together to form a large multinucleated Langerhans type of giant cell. They are in turn rimmed by small dark cells called the lymphocytes. Finally, you find that there is a basket oven pattern of fibroblast which is seen. This is a classical picture which you people shall draw. This itself can be a question in the form of an essay, a short note, or it can be a chart, a multiple choice question, a specimen, or rather a slide that can be kept viva voce, which is extremely important. The sources for this will be R.A.T.S, Game, Tips, and Robbins. I had given a complete notes of it in my book, The Tips. And the lecture on leprosy is vivid in R.A.T.S. See you again in the next class. So this will be the summary of it. I would like you people to kindly recollect all that is shown on the screen and describe them in detail. Thank you.